Welcome, everybody. This is Apostle Tina McCray and Without a Trace Ministries. And welcome to those of you who are joining me with Truth of the Day with Coach Tina McCray. Again, this is one of those dual programs that I have for you for people who need Medicaid or are on Medicaid and need to know what to do. So, again, this is a new area for me, but because we want to help people who living with dementia, Alzheimer's disease, and their caregivers and seniors, period. Right now, we just want to help anybody that needs to know about this type of care. And I have a long-time friend and person who's been serving our family when my mom had moved here and we started having to have answers to these questions. Joe Crawford has been with our family since about 2018, 2017, 2018, and has helped us through this whole process over time with our mom. And so I remember what I felt like, and me and my brother, how nervous we were with both Medicare and Medicaid. We didn't have a clue. And so we talked about Medicare last time, and I think Joe, he mentioned Medicaid, and I couldn't leave those of you who have questions about Medicaid out. So first, I want, for those who didn't know about that last program, I want to welcome Joe Crawford to the program, and I want to let people know on YouTube and Facebook, you ain't have to cancel us. We're not trying to sell anything. We are informing people about what they need to know about these particular areas of coverage because people need to know knowledge is power. And so, again, Joe, I want you to introduce yourself and then tell us about, what is Medicaid? How's it different from Medicare?
Okay. Yes, my name is Joe Crawford. I've been in insurance since 2000, and I've been in Medicare uh, Advantage since about 10 years. Okay, so first of all, Medicaid. I want to be specific on what Medicaid. Medicaid is eligibility depends on the state-specific rules, but generally includes groups such as pregnant women, children, people aged 65 or older, and those with disabilities. Eligibility often based on factors like age, income level, family size, and disability status. Georgia, for example, has a specific program for low-income adults. So uh, to put it in a nutshell, uh, Medicaid, Medicare is federal, but Medicaid is state. This is where the state helps in our health for, like I said, pregnant women, children, and people 65 and older, and people with disabilities.
Got it. Okay. And is there such thing as a open enrollment or annual enrollment for Medicaid?
No, actually, that's one thing I didn't deal with in the other is it's a thing called special enrollment period. That can depend on a catastrophe, loss of coverage, uh, gain of coverage. So those are special enrollments. So, but with Medicaid, is no specific time to enroll in those. It's
Mm,
either it's a gain or loss, like a father pass away and the kids they don't have. So a lot of times they are qualified for Medicaid. A pregnant young lady or a woman with a child, they will apply. They can apply for Medicaid, and people, as you see, who make under the poverty level. I think in Georgia, I think it's like 1,100 a month. Uh,
okay.
so if you make under, I'm not, it's somewhere in that area. But if you make
Okay.
under that and you have a health issue, you can apply for Medicaid.
Okay. Um, a lot of people, we've been hearing about all these different cuts and stuff like that when it comes to Medicaid. So if a person needs Medicaid, where do they start? Do they go to the Empower line? I talked about empowerline.org. I
Mhm.
believe that's what it is. Is that where we go? to get that kind of stuff, or do they go to a broker, like an insurance broker? The difference between an insurance broker and an agent, where most time independent agents or individual agents sell one type of product for one company. Almost, excuse me, one they sell for one company multiple products, or maybe a singular. But for a broker, you tell us about all types of companies that sell variations of products, correct?
Now, I can speak for because I've dealt with is Georgia is Medicaid, um, GeorgiaGateway.gov. That's Georgia Medicaid. That's where you go and you apply for SNAP. You apply for health. That's where you can apply for Medicaid. That's where you can apply for certain things. And so that is the place where you would go, for that. Sometimes your broker slash agent can help you with that. But that's where you go. You can go online, or you can physically go to a Social Security place.
So is it just spell out Georgia, Georgia gateway
Dot,
dot gov? Is that what you
mhm.
said? Dot gov?
GeorgiaGateway.gov, or it might be Gateway Georgia. I think it's GeorgiaGateway.gov.
I think it is too. Let me go pull it. Let me just
And
see.
if you in another state, they have their, I don't know what their, different states got different names for their how to apply for Medicaid and food stamps. Yeah.
No, it's not Georgia. Hold on. Uh, I know it's Georgia's gateway. Let's see. Georgia Gateway portal. Let's see what it is. Okay, so here it is.
Georgia.
It's www.gateway.ga.gov.
Hmm.
Does that sound right? So
Yes,
it's www.gateway.ga.gov. That's your Georgia gateway. Um, and so that helps you to figure out how to apply. So it talks about knowing your eligibility, how to apply for benefits. You can manage your account there. You can log in. And I know as a caregiver, I had to get an account and help my mom figure that out. So that I know that can sometimes feel intimidating, but if you have an organization, even like Visiting Nurse Health Systems, I keep talking about them. They helped me get to apply. And the people at Empower Line, in Georgia, if you're in Georgia, I'm in Atlanta. So for those of you who are not, I apologize. You may find somebody like, you know what it is? Most states have a regional commission. All right. So if it's empowerline.org, empowerline.org, they are a part of the Atlanta Regional Commission, ARC. And so all different regions in Georgia have a regional commission. And under that, they help with senior services and all types of services that people need. So in your state, look and see if you have a regional commission for where you are and see how to get that help and get those services that you need. Okay. So I want to make sure you don't feel left out if you're not in the state of Georgia. But if you're in Georgia, empowerline.org is where you can start. And then you can ask them to connect you to Visit Nurse Health Systems. Or if you just tell them, hey, I need CNA support, I need to know how to apply for Medicaid, I need some help, right? You can start there. Or we're going to give you Joe's contact information and he can connect you to some people as well. And Joe, you were saying that you may not be like you are less licensed for sure in certain states, but if somebody reaches out to you and you're not licensed in their state, you got people that can help them, right?
that's right.
So what are some gotchas or some fears that you hear people have about Medicaid that you could possibly answer today?
Well, one of the ones is the bill that's in office. It might not show up this year, but it's probably going to show up in by midterms, 27, year 27. That is going to be uh, some cuts. I don't know what that look like, but that is a fear.
Okay. So people are going to feel it more in 2027 than they may in 2026,
That's
perhaps.
correct.
So what are you telling, what are your clients when they're asking you, man, what do we do to brace ourselves or to get ready? I know, as a pastor, I know there are organizations and church at the end of the day, churches, I challenge churches. We've always been doing outreach, and
Hmm.
I'm praying to ask God, Lord, bless us with finances to do more to help people. But churches used to do, give people food. We had food pantries everywhere in churches. They had clothes closets. They had things like that, and even health fairs. Maybe we'll
Right.
see more health fairs pop up at churches to do. So not only, you know, when people are bracing themselves, that's what's coming to my mind is that we need our churches and community services places to step up. But what are you telling your clients when they're asking, what do I do when these cuts come?
Well, just like this, the same principle that you just said, I have, you know, pastoral background as well. That when God puts something on your heart about something that's coming, you prepare. And so I partner with, like you said, churches, with organizations. You keep your ear and listen for the things that people offer, and you connect, you network, and you provide. That's what a broker is. He connects. He or
That's
she
good.
connects people to services. The
That's
pastor
good.
connects God to people. That's what we connect people, and so
Yes.
that's what I do. I find, if I can't do it, I find it, and to help my people.
Amen. Me too, Joe. I don't have all the answers and all the money, and sometimes it's not money. I love Pastor Terrence Evans over at St. Paul AME out here
Hmm.
in Covington, and he was telling his congregation that, hey, we got to help each other, and it's not always money, it's the
Right,
connections, it's knowing who and where to go. And
right.
so that's what we do. That's the type of apostle I am, is a connector. I'm the horizontal apostle that connects and convenes, and so that's why I'm connecting y'all to Joe, because you need to know. I want to take some of the fear out of what's happening to Medicaid and how do you apply if you need it. What do you do? And another thing too, Joe, about Medicaid is that I hear people say, I don't want to get on it if I gotta live broke. So if I got to be under the poverty line, I can't make so much money. I need the help, but I can only make so much money and I need money to survive. So I'm going to have to figure out, maybe I can't be on Medicaid if I can only have this kind of money. What do you say to people like that?
Well, one of the biggest expenses that people take to the grave is health care. And uh, if you qualify for Medicaid and you're on Medicare, they call it D-SNPs, special needs patient. And a lot of your bills will be covered under that plan. Most people who have on a D-SNP plans, there are several types of D-SNP plans. Well, that's when you have Medicare, which is federal, and Medicaid, which is state. And you have both of these organizations helping help you with your health care. And most of those people who have D-SNP plans pay very little of the cost. They have the federal and they have the state taking care of it.
That is true. My mom had that. And I thank God because, hey, I was marching toward retirement for myself. And there for a while, I was coming out of my pocket to pay for her medical bills.
Right.
And I even have one of the devotions in my journal, my daily prayer journal and devotional called Mama, Where Are You Going? And one of the devotions called Who's Paying for This? Because every time we got ready to go to the doctor, she was like, well, who's paying for this? And a lot of times I was like, shoot, that's what I want to know. Because a lot of times it was me paying for it. And I was
Right.
like, Lord, you got to help me. And that's when I learned about how to get on both Medicaid and Medicare for her. And that covered her stuff. and then it was less coming out of my pocket. So I'm telling you, as a caregiver, you need to figure out how to get them on there. Don't listen to, yeah, there's stuff cutting, but get on there until it's cut, child, in the name of Jesus.
Yeah, for example, for in some plans, people who with D-SNP plans, they have over $250 per month that they can pay, buy food, pay utility bills, buy gas. They have over the counter upwards to $100, $200 to buy like uh, 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 the pads, the pens, and things of that nature. Where these little costs that just eat at your pocket, that they're covered, and
Wow.
also your medications are paid for on most of these plans, a lot of these plans, and so I would recommend that because, like I said, most people who pass away have big medical bills.
Wow. And that's passed down to the people that's, already dealing with the fact that you haven't failing health and now they have to deal with these bills that are left. And
Yeah.
so this is a good thing. This is knowledge. This is why we're here, is to give you this information so that you can remember you can go to Georgia, gateway.ga.gov, gateway.ga.gov. And so if you're in another state and you're listening to this, because I know the radio program is global and so is this, it's on YouTube and Facebook Live, then you find out where remember, Medicaid is state funded. So you want to find out where to go in your state to apply for Medicaid. You can Google tells you everything. So you can find out how to get that in your state. So in Georgia, it's gateway.ga.gov. And I want to thank you so much, um, Joe, for being on. Again, I said we've been knowing Joe for a long time. He's helped our family with my mom, and he's helped some of our members at Without a Trace, and great man of integrity. How do people get in touch with you, Joe, if they need to ask you more questions about, life insurance? That's another thing. A lot of people now are using GoFundMe. I saw somebody, a pastor, say GoFundMe is not your insurance policy. So we need people to know about life coverage and things like that too. How do people get in touch with you just to learn about some of those things?
Yes, you can go to Crawford Joe 40 at yahoo.com. You can also go to my phone number, 678-852-1442.
Again, that's Crawford, CrawfordJoe 40 at yahoo.com. And then you can call him at 678-852-1442. All right. Well, we want to thank you all for joining us. If you have questions, put them in the chat or in the comments, and we will make sure that Joe gets those questions. And if we get enough questions, we'll bring Joe back just to answer your questions, whether it's Medicare or Medicaid. We'll do a combo session and bring him back. So thank you again, Joe, for being on with me. He tells me that I remind him of one of his cousins, so we call each other cousin. And so I really, really appreciate you. I mean, for me, it's really given me a peace of mind knowing that I'm able to give other people a good peace of mind about these subjects. Thank you, Joe, so much.
You're welcome.
And thank you for joining us on Wellness Wednesday and Truth of the Day with Coach Tina McCray. And if you need to get in touch with us, you can reach out to us at www.withoutatraceministries.com. And you can, send us emails there. You can send prayer requests. You can tell us what you want to hear more of on Wellness Wednesdays and on Truth of the Day. And by the way, I must tell you about the program with BJM Dementia Services. For those of you who have our caregivers of loved ones with dementia or Alzheimer's disease, real quick, I want to remind you that we have a scholarship for caregivers to take a break. A respite is called a break or rest. And so if you have time to tell people about how tired you are or what you don't have time to do, you have time to click on this link and go and apply for this respite scholarship and get you $200 for free to take you a break. Now, you do need to attest that you are a primary caregiver by either send an attachment here of the attestation or send a copy of your POA, a power of attorney document. But you get $200 just by applying. Our goal is to do 25 of these by the end of 2025. So get your application in. And guess what? You think at $200, honey, you can get your nails done and let somebody sit with your loved one, go out for a nice dinner and get your loved one, have somebody sit with them. Or you can send them to a day program while you get a nap. These are things that people are doing with this money. And so we don't tell you what to do, but if you need some resources or places to go and do, we got a resources link right here. And so there's places that you can click on here and find out more. And if you don't need this, but you want to help, there's a donate button. You can donate right here at WATM Cares because we care for you. And that's my beautiful mother, Barbara Jean Metcalf,
Yeah.
a mother
You
of the
know, I
Lord's.
remember her seeing her face
Oh,
telling me about how she like up in the
oh
where
my goodness.
Tennessee? Was it Tennessee?
Yeah, she lived in Louisville, Kentucky, and then we brought her down
Kentucky.
here to stay with us. Yep.
Oh
And
yeah.
so I just oh my goodness, when I look in the mirror, I see her every day now. So I
Mm.
just want to thank you again. Thank you all for joining us on this Wellness Wednesday break. I wanted to give you this update, and so we say God bless you and have a kingdom.